Imagine that feeling, the anticipation, the hope that comes with expecting a child. It's so fundamental, right? Universal. Now try to picture that same feeling being completely swallowed by, well, by sheer terror. A situation where bringing life into the world becomes this desperate, dangerous fight. That contrast, that really stark reality is what we're diving into today. We've been looking deep into reports and accounts from Nigeria's northeast, specifically the maternal health crisis there. It's heartbreaking. We're talking about unbelievable challenges women face just trying to have a safe pregnancy, a safe birth in a region torn apart by conflict. So our aim here is to unpack this crisis with you. Not just what's happening, but why. The tangled factors that make pregnancy such a perilous journey there. Think of this as your way into understanding a really critical, urgent humanitarian issue. Let's get into it.
It really is striking, isn't it, how sometimes you need that one personal story to truly understand the scale of something so vast. It puts a human face on the statistics.
Yeah. Absolutely. And to really get the gravity here, we need to start there. Let's talk about Aisha Muhammed. She's 25, from Kanduga in Borno State. We learned about her situation from early 2025, right as she was heading into her third trimester, and suddenly she's hit with eclampsia, which, for anyone listening who doesn't know, isn't just, high blood pressure, it's severe. Convulsions, extremely dangerous pressure levels. It's a major killer of mothers globally.
And the situation on the ground for her was dire. The local clinic, no doctor. Simple as that.
Right. And the nearest place that could actually handle eclampsia? Maiduguri, 40 kilometers away.
Yeah, and calling it 40 kilometers away doesn't capture it. That's not a simple drive. It's navigating one of the most dangerous regions on the planet.
So you're in labor, facing a life-threatening emergency.
Exactly. And the journey itself is potentially lethal. Every minute, every kilometer feels like a risk. Access isn't just about distance. It's about the sheer danger of trying to get there.
Against all odds, Aisha made it. She got to the city, had a C-section, and delivered healthy twins in April. Which sounds like, a miracle ending.
A huge relief, undoubtedly.
Yeah.
But what stayed with us, what really hits hard, is the trauma it left behind.
She told interviewers, and her words just stick with you. Even though children are a source of joy, if I have to go through the same ordeal again, I am afraid of getting pregnant.
Think about that. A mother, having just brought twins into the world, is now afraid to get pregnant again.
It's profound.
It says everything, doesn't it? Her fear isn't just personal, it's a symptom. It shows a complete breakdown where safe childbirth, a basic right, is just gone. Women are literally weighing joy against the very real possibility of death.
It's gut-wrenching. And Aisha's fight, her fear, it forces us to look at the bigger picture. This isn't just one story. It's part of a massive catastrophe.
The World Health Organization data is stark. Nigeria has the highest maternal mortality rate in the world.
The highest. And the numbers are just staggering.
They really are. At least one woman in every 100 in Nigeria dies during childbirth. 1 in 100.
And in 2023 alone.
Over 75,000 maternal deaths. That was a full quarter of all maternal deaths globally, just from Nigeria.
A quarter from one country.
It's almost impossible to wrap your head around. It points to a systemic collapse on a massive scale.
So that number just screams, why? It doesn't. Let's start peeling back those layers. What's driving this? The first, maybe most obvious factor seems to be the conflict itself.
Absolutely. That pervasive insecurity is layer one. You have Boko Haram's resurgence, this brutal campaign going on for, 14 years now? Violence, kidnappings.
And it's turned communities into battlegrounds.
Exactly.
Yeah.
So for a pregnant woman, the direct impact is immediate. Roads get closed constantly because of fighting, reaching a clinic or hospital.
Yeah.
Sometimes it's just impossible.
It makes seeking help a life-threatening gamble in itself.
Right. And the ripple effect is huge. It destabilizes everything. People flee, services break down, and those left behind are even more isolated and vulnerable. Fear becomes its own barrier to care.
Healthcare just can't function properly when society around it is in chaos.
Precisely. Which brings us to the second layer, the state of the healthcare system itself, even where it hasn't been completely wiped out by fighting.
And what we found there is, well, it's grim. Facilities are often critically understaffed.
And under-equipped.
Yeah.
Massively so. There was this one detail just chilling from a government hospital in Kanduga.
I remember reading this.
Surgical instruments were seen soaking in water, absolutely infested with flies.
Just wow. That image says so much about the breakdown. It's not just lack of fancy equipment. It's basic hygiene, basic standards gone. Treatment itself becomes a risk.
Yeah. And adding to that, there's the brain drain. Doctors, nurses, many have fled. Understandably.
We heard from Dr. Fania Fochabe, who works with the International Rescue Committee, the IRC, in Borno. She talked about the struggle to recruit.
She basically said they put out ads, but nobody is willing to come.
And when you look at the pay,
It's unbelievable.
huh.
Doctors earning between maybe $99 and $156 in a month
Mhm.
in those conditions, risking their lives.
So it's a vicious cycle. Conflict pushes people out, and the lack of resources and security means you can't attract them back.
Exactly. It guts the system right when it's needed most.
And sometimes it's not even about understaffing. Facilities are just gone, like Mugumeri's main hospital.
Destroyed, wiped out by Boko Haram back in 2020. So sometimes you're not fixing, you're starting from zero in an active conflict zone.
Okay, so we have the conflict making access dangerous, and the healthcare system itself in a state of collapse. What's the third layer here?
It seems to be about lifelines drying up, specifically funding and policy decisions, both internationally and domestically.
Right. We found there's been a really significant drop in foreign aid. Looking back, between 2020 and 2025, USAID provided nearly $4 billion to Nigeria.
And a big chunk of that, about $423 million, was specifically for maternal health and family planning. Crucial funding. Well, under the Trump administration in 2025, that specific funding apparently just vanished. It disappeared.
Vanished. And when inquiries were made,
The U.S. Embassy didn't respond. So there's a lack of clarity, but the outcome is clear. Less money for vital services.
that silence is quite something. But it's not just the U.S., is it? Other priorities seem to be pulling funds away, too.
That's right. Other major global crises, Ukraine, Gaza, Sudan, they've understandably shifted international donor priorities. But the consequence for places like Northeast Nigeria is that they get left behind. Their funding streams shrink even further.
And compounding all of that, there are domestic policy issues, too.
Yes. The Nigerian government itself made a decision in 2025 to cut its own family planning budget.
Yeah.
Drastically.
How drastic.
By nearly 97%.
97%. Wow.
So even women who want to avoid pregnancy, who
Yeah.
want to plan their families in this incredibly difficult context,
Yeah.
find themselves with very few options. It adds another layer of pressure onto a system that's already failing.
It really is a perfect storm. Conflict, collapsing healthcare, drying up funds, policy decisions.
And it all comes back to what Aisha said she needed. Remember her list.
Yeah, it was so simple, so clear. Hospitals, personnel, drugs, and open roads for emergencies.
It perfectly mirrors the systemic failures we've just talked about.
And her conclusion was just devastatingly straightforward. If there are all these, women will not be losing their lives here. It cuts through everything.
It really does. And her story, while ending in survival, isn't the only one that stayed with us. There was also Aisha Muhammed.
Right. Her experience really highlights the enduring trauma, the human toll. Tell us about her.
Aisha's story starts in 2021. She went into labor in her village, Blebilingara. Like Aisha's village clinic, her village had no hospital at all.
So another desperate journey for care.
Even longer this time, 57 kilometers to Maiduguri. But for Aisha, the journey was too long. She started bleeding severely,
Oh, no.
and she delivered a stillborn baby while still en route to the hospital.
Heartbreaking. Just absolutely heartbreaking. It shows what happens when even basic emergency care is out of reach.
Exactly. And her story continues. She's 30 now and pregnant again, living in Mugumeri,
The town where the main hospital was destroyed.
the very same town. So now she has to rely on a mobile clinic, which offers some help, of course, but we learned it's completely unequipped for actual childbirth emergencies.
So she's facing another pregnancy, carrying the weight of that previous loss in a place with even fewer resources than before.
The mental anguish, the fear, it just lingers. It's this invisible burden on top of everything else, a cycle of fear and loss that's tragically common there.
Looking at the bigger picture then, is there any acknowledgement of this collapse from the authorities?
Yes, the Borno state government has acknowledged the healthcare situation is dire. They cite the insecurity, the conflict, as a primary reason. So there is awareness, officially.
But acknowledgement isn't enough if the root causes aren't addressed.
Precisely. And despite the Nigerian military's efforts, Boko Haram attacks are still happening almost daily. They continue to disrupt life, disrupt access, turning towns into militarized zones.
Which makes rebuilding or even just maintaining services incredibly difficult.
Extremely. And it puts immense pressure on the aid agencies still operating there, like the IRC, the International Rescue Committee.
We heard they're described as one of the few international aid groups left.
Right. They're trying to fill this enormous gap left by others who've pulled out, but the scale of the need is just overwhelming.
So at the end of the day, mothers are still dying, simply because they can't get to the care they need when they need it?
That's the tragic reality. Basic, fundamental services for safe childbirth are either gone, destroyed, or too dangerous to reach. It's a profound human rights crisis unfolding every single day.
So bringing this all together from our deep dive, it's this devastating mix, isn't it? You've got the constant insecurity from the conflict, you have a healthcare system on its knees due to underfunding and decay, and then you have international support shrinking.
hmm These aren't separate issues. They weave together to create this incredibly dangerous environment for pregnant women in northeast Nigeria.
And even though this is happening far away from many of us listening, the themes feel universal. Conflict, aid, the fragility of essential systems under pressure.
Absolutely. It shows how decisions made globally and conflicts fought locally have these deeply personal life and death consequences for individuals. It really turns the miracle of birth into a test of sheer survival.
Which leaves us, and you listening, with a difficult question to think about, I suppose.
Yeah. In a world facing so many crises simultaneously, other wars, climate change, economic instability, how do we make sure that something as fundamental as the right to a safe birth doesn't just fall through the cracks? How do we prevent it from becoming another casualty of neglect, especially for people already living in the most dangerous circumstances?
It's a question about priorities, about our shared humanity, really, especially when you consider the lives hanging in the balance.